Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, September 17th, and this is our COVID briefing. Today in Missoula County, we're reporting 113 new COVID-19 cases and 1,163 active cases. Our 7-day average incidence per 100,000 people is now 87. We have 34 Missoula County residents hospitalized and 14 out-of-county residents hospitalized in Missoula County, and we've now had 116 deaths due to COVID-19. Today I have a lot to cover. I'm going to talk about the local and regional hospital situation, some disheartening records that we've broken this week, booster doses of vaccine, masks, cases at the University of Montana, cases in kids, and a reminder to stay home when you're sick. So first, our hospital situation. Yesterday, hospitalizations in Missoula broke the record for the highest that we've seen during the pandemic, with 46 patients hospitalized, and today that number's even higher with 48 patients hospitalized for COVID. The previous record occurred last November with 43 patients hospitalized. Just a reminder that when we're reporting hospitalizations, these are people that are hospitalized in order to treat their COVID symptoms, not just people who happen to test positive prior to having a procedure or some other intervention. Earlier this week, Providence St. Patrick Hospital announced that they're triaging COVID-19 patients in their ambulance bays as they've run out of space to do this due to the high volume of patients coming in with COVID symptoms. Providence also says that these patients are largely unvaccinated and now younger, with the average patient being aged 45 to 50. Today, they reported that they're seeing some people in their 20s and 30s who are requiring hospitalization. To put that into perspective, last winter, the average age of a hospitalized COVID patient was 80. Community Medical Center and Providence St. Patrick Hospital are begging the public to get vaccinated. Other hospitals outside of Missoula County have made plans to move to what's called crisis standards of care very quickly if they have to. Those hospitals include Billings Clinic and Bozeman Deaconess. Crisis standards of care essentially means that hospitals must ration care to patients and prioritize patients who are more likely to survive, and in some instances only provide pain relief or comfort for those who are less likely to survive without invasive measures such as ventilation. Also, yesterday, all hospitals in Idaho activated crisis standards of care. Last week, this was only taking place in the northernmost parts of the state. Regionally, our hospitals are in a very vulnerable position. We need everyone to do what they can to limit this surge to keep our hospitals functioning. They're reaching dangerous levels of capacity, which will impact even non-COVID patients. The assistance of the National Guard has at this point been requested, and we expect to see them being deployed here to Missoula to help out in the next week or two. I guess the message that we're trying to get out is that we really need to go back to where we were in the spring of 2020 when we were howling for our healthcare workers to show them that we support them. We were limiting our social interactions to reduce the chances that we would become infected. We were trying to flatten the curve to protect our healthcare resources. We need to go back to that mindset and do everything that we can as individuals and as a community to reduce this pressure on our healthcare and our public health infrastructure. Wear a mask, practice social distancing, wash your hands, keep your social circles small, and get vaccinated if you can. This is how we're going to keep our hospitals from following what's happening in Idaho and having to ration care to their patients. So next, I want to talk about some of the records that we've been breaking. I just mentioned that we broke the hospitalization record in Missoula County. In the past week, we also broke our record for the most cases in one day. 157 cases were reported on Saturday, and today we broke our record average daily new cases per 100,000 in the last 7 days. The record was previously 85 on November 21st last year. Today it's 87. For context, anything above 25 is considered a tipping point of rapid spread in the community, so we are way beyond that point right now. Next, I want to talk about booster doses for the vaccine. The FDA is meeting today to decide whether booster shots will be approved for COVID-19 vaccines. The FDA has cautioned that they may not be approved at this time. If boosters do get approved, we do not yet know the details, such as they may only be approved for Pfizer, but maybe not Moderna. We also don't know if boosters will be recommended at a 6-month or an 8-month interval. If the FDA does approve booster doses, the CDC will then outline the guidance. Our health department and our clinic over at Southgate Mall can't vaccinate anyone with a booster dose until we get that CDC guidelines, which will take several days. And again, that's only if they are approved. So we are asking you to just stay patient with us as we follow the proper steps in that process. Next, I want to talk briefly about masks. Our health officer, Deshane Barnett, and cultural epidemiologist Elizabeth Williams with All Nations Health Center released a short and easy to understand report explaining the science behind using masks to slow the spread of COVID-19. There has been a lot of confusion with that topic, but that report is available on the homepage of MissoulaInfo.com. We encourage everyone to read it, and please wear your masks. Next, let's talk about kids. Schools with high vaccination rates are showing that it's possible for students to return to the classroom without COVID-19 outbreaks. The San Francisco School District released a report last week that they have had no COVID-19 outbreaks since school began on August 16th. This was attributed to 90% of the students aged 12 to 17 being vaccinated for COVID-19 and universal mask use. This is hopeful news, and we strongly encourage Missoula County parents to please get your kids vaccinated if they are in that age group that is eligible, and have them wear their masks in the classroom so that our kids can stay in school. While no schools in Missoula County have had to move to remote learning due to an outbreak, several Montana schools have had to move to distance learning because of outbreaks in their schools, which is really discouraging. We want to do everything that we can do to keep our kids in the classroom. As far as the University of Montana, as of today, there are 57 active cases at the University of Montana. Just a reminder, 1 week ago, I reported that there were 19 active cases there. 20 to 29-year-olds are making up roughly 20% of all active cases right now, and just over 52% of that age group have received one dose of COVID-19 vaccine. So we're urging all college-age adults to please get vaccinated, mask up, and keep your social circles small, and practice social distancing when you can. There's a lot of room for folks in that age group to make a big difference in regards to this pandemic. Lastly, we received a number of calls from employees this week who were concerned about their employers asking them to come into work despite being COVID positive, having symptoms, or being a close contact. We are in a very delicate situation with our hospitals and cannot afford to have super spreader events. If you've been given a quarantine or isolation order from the health department, it is legally binding and you really do need to stay at home. Having people stay home when they're sick and when they are waiting for test results because they're having symptoms is one way that we are going to be able to get through this pandemic. So we just need to continue to try and reduce the spread. So that's it for my briefing for today. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFar.